Some people still find it quite confusing to accurately differentiate between type 1 and type 2 diabetes. So in this video, I would give a clear explanation of type 1 diabetes, and there would be a follow-up video where I would also clearly explain type 2 diabetes, helping you to get the difference. Now this is going to be fun and quite different from what most of you are used to. The reason is because we will be using an animated 3D representation to contrast between what's going on in the body of a normal person and what's going on in the body of someone with diabetes. My name is Malcolm Chikadibia Iheremela, and this is Malcolm's Anatomy. Let's get started. Welcome back, guys. As promised, what you can see on my screen is an animated 3D representation of a young male human body, which we will be using to explain type 1 diabetes. So to get started, whenever you hear the word diabetes, be it type 1 or type 2, the affected organ that should come to your mind is the pancreas. Now, let's take a closer look at the pancreas here. This is the pancreas, located in the upper left abdominal region, sitting just below the liver. Now, this brings us to the focus of this video, which is what is type 1 diabetes? Well, it has been described as an autoimmune disorder that is characterized by insufficient production of insulin. Now, when we use the word autoimmune disorder, what are we talking about? Well, an autoimmune disorder occurs when the body's immune system, which is responsible for protecting the body, attacks and destroys healthy tissue or tissues by mistake. There are more than 80 types of autoimmune disorders, and type 1 diabetes is one of them. So the immune system destroys the cells, that is the beta cells in the pancreas, which are responsible for producing insulin, and as a result, insulin levels are low. This is type 1 diabetes. Now, these yellow substances you can see coming out from the pancreas are representing insulin, which is the hormone responsible for regulating blood sugar levels and also energy metabolism. Now, let's take a deeper look into what is going on in the pancreas. So we are inside the pancreas, and you would see clusters of different cells. For example, we have the alpha cells, then we have the F cells, we have the delta cells, and lastly we have the beta cells. But our focus is primarily on the beta cells because they are the ones responsible for the production of insulin. You can see insulin, the yellow substances coming out from the beta cells and then migrating into the capillary blood vessel. Now, the red substances you can see flowing through the blood vessel are representing red blood cells, while the blue substances flowing alongside them are representing glucose. Glucose level or blood sugar level rises after eating. Now, this causes or stimulates the pancreatic beta cells to produce insulin. Why? Because insulin allows glucose in the blood to enter cells where they are converted into energy. Now, when the glucose level in the blood decreases, the pancreas lessens insulin production. Therefore, insulin helps to maintain a balanced blood sugar and energy levels. Now, this is the process that occurs in the pancreas of a normal person, that is someone without type 1 diabetes. Now let's see how this process is altered in the pancreas of someone with type 1 diabetes. Here we can see what I'll call immune attackers. You can see them going into the beta cells to cause damage. Now when they damage these beta cells, the beta cells are now unable to produce sufficient insulin to properly regulate blood sugar levels and energy metabolism. You will see that the quantity of insulin being produced now that are going into the bloodstream are low. Now what happens? Cells tend to absorb less glucose and sugar levels remain high. Remember we said that insulin helps glucose to leave the blood and enter cells, serving the purpose of regulating blood sugar levels. Now let's see how this actually happens. This environment is giving us a clue on how glucose finds its way into a cell. The blue substances you can see floating at the top there are representing glucose. The yellow substances here are representing insulin. Now in order for glucose to enter a cell, insulin has to bind to these orange receptors. You can see the binding taking place. So they have to bind to these receptors. Now what happens when insulin binds to a receptor? Take a look at this. These other structures here are glucose transporters. Now when insulin binds to a receptor, glucose transporters open in order to allow the passage of glucose into a cell. So in order for glucose to enter a cell, insulin has to bind to a receptor, which in turn will cause glucose transporters or channels to open so that glucose can now enter into a cell. Now this is the process that occurs in the body of a normal person. Once again, let's see how this process is altered in the body of someone with type 1 diabetes. Now this other environment is showing us what happens in the body of a patient with type 1 diabetes. Remember we said that sufficient amount of insulin is not produced and there is no sufficient binding of insulin to a receptor, causing the glucose channels to remain closed. You can see that. So when insulin does not bind to a receptor, these glucose channels or glucose transporters remain closed. And what happens? You can see so many glucose in the blood. You can see the one there floating in the blood. So glucose levels remain high. No binding, no passage. So now let's take a look at some common symptoms of type 1 diabetes. We have fatigue and mood changes. Now this can be potential symptoms of type 1 diabetes. In some cases, high blood sugar levels can lead to feelings of tiredness and irritability, affecting a person's overall mood and well-being. We also have blurry vision. Now, when blood sugar levels are consistently high, it can cause the lens of the eye to swell, leading to temporary changes in vision. We also have unexplained weight loss and stomach upsets. When the body doesn't produce enough insulin, it can't effectively use glucose for energy, leading to the breakdown of muscle and fat and causing weight loss. Additionally, high blood sugar levels can cause gastrointestinal issues like nausea, vomiting, or stomach pain. And lastly, we have frequent urination and bedwetting. This especially occurs in children. When blood sugar levels are elevated, the kidneys work hard to remove excess glucose from the blood, leading to increased urine production. And this can cause a need for more frequent visits to the bathroom and in some cases bedwetting. So in conclusion, Recognizing the early warning signs of type 1 diabetes is crucial for timely diagnosis and effective management. Symptoms like fatigue, blurry vision, frequent urination, bedwetting, they can serve as red flags that should not be ignored. So if you or someone you know is having these symptoms, please do well to seek medical advice to ensure proper care and a healthier life with type 1 diabetes. Let's stay vigilant, guys. Let's stay informed, and together let's raise awareness about type 1 diabetes and empower each other to face its challenges and with resilience and hope. Thank you once more for watching this video till the end, and remember, we have type 2 diabetes coming up next, so please do well to like, leave your comments, share, and also remember to subscribe. My name is Malcolm Chikadibia Iheremelam, and this is Malcolm's Anatomy.